Hello everyone, my name is Janine and my partner is Joanna. Today, we will be discussing how nursing informatics supports safe patient care. We will present a clinical scenario, explore a digital decision point, identify a safety issue, and demonstrate how nursing judgment and technology work together to improve outcomes. Our focus will include long-term care settings, highlighting care coordination beyond the hospital. In our scenario, we are working in a long-term care unit during a day shift, and our patient is an 82-year-old male who has just returned from the hospital after treatment for pneumonia. The patient has a history of hypertension and atrial fibrillation and was prescribed new medications during hospitalization, including an anticoagulant and an antibiotic. Upon reviewing the electronic health record, I noticed that the hospital discharge medication list has been uploaded. However, it does not match the long-term care medication administration record. Specifically, the anticoagulant appears on both lists but with different dosages, and the antibiotic ordered in the hospital is missing from the long-term care record. This creates a high-risk situation where the patient could receive a duplicate dose of anticoagulants or miss an essential antibiotic treatment. This discrepancy represents a medication reconciliation error and poses a serious patient safety risk, including bleeding complications or untreated infection. A key clinical decision point occurs before administering the scheduled morning medications. Before proceeding, I would compare the hospital discharge summary with the current medication administration record, verify medication orders, dosages, and frequencies, check for high-risk medications such as anticoagulants, assess the patient's current condition, vital signs, symptoms, cognition. Consult the most recent physician or pharmacist notes. This step is critical to prevent medication errors and ensure safe, accurate care. One important informatics tool in this scenario is the electronic health record, particularly medication reconciliation features and clinical decision support systems. These tools support patient safety by flagging discrepancies between medication lists, providing alerts for duplicate therapies or drug interactions, offering access to updated discharge summaries. However, they can also complicate care if alerts are excessive or unclear, which may lead to important warnings being overlooked. A key limitation in this scenario is incomplete data integration between hospital and long-term care systems. For example, the system may generate multiple alerts, making it difficult to prioritize critical ones. Medication lists may not automatically synchronize across care settings. To compensate, I would rely on clinical judgment by prioritizing high-risk discrepancies, communicating directly with the pharmacist or physician, holding medications if necessary until clarification is obtained. This ensures patient safety despite system limitations.
In the Canadian healthcare context, nurses are responsible for maintaining patient privacy and confidentiality, following standards set by the College of Nurses of Ontario. We must also ensure accurate and timely documentation to support safe, continuous care and maintain accountability. Advocating for patient safety is essential, which includes recognizing risk and speaking up when concerns arise. Reflecting on this, critical thinking is key and goes beyond relying on technology. We must use our clinical judgment. We are accountable for preventing medication errors through careful verification and safe practices. Finally, leadership means speaking up about system issues to improve patient outcomes and promote a safer healthcare environment. This workflow begins with the nurse completing a patient assessment, followed by receiving the information in the electronic health record. If a discrepancy is identified, such as a mismatch in medications or orders, the system may trigger an alert. The nurse then verify the issues using clinical judgment. Next, the nurse communicates with the physicians or pharmacists to clarify the concern. Once confirmed, the order is updated accordingly. Finally, the nurse proceeds with safe medication administration based on the corrected and verified information. One suggested improvement would be implementing prioritized alerts that clearly distinguish high-risk medication discrepancies, along with better interoperability between hospital and long-term care systems to ensure accurate real-time medication reconciliation. Reflecting on this scenario, we recognize how easily medication errors can occur. During transition of care, particularly when there is a mismatch between hospital discharge order and the long-term care medication administration record. This reinforces the importance of medication reconciliation as not just a task, but a critical safety responsibility. What stands out to us is that even the access to electronic health records and decision support tools, there are still gaps such as delayed updates or incomplete information. This reminds us that technology should support but never replace our clinical judgment as a nurse. We also reflect on our professional responsibility to advocate for our patient. This means taking the time to verify medications, questioning inconsistencies, and collaborating with the healthcare team before proceeding with administration. Holding a medication when something does not feel right is not a delay in care, but an action that protects patient safety. Overall, this scenario has strengthened our understanding that safe nursing practice requires a balance of technology, critical thinking, and accountability. As a nurse, we see our role as being proactive in preventing errors and ensuring that every medication administered is both accurate and appropriate for the patient. And these are references. As future nurses, we recognize that while technology is a valuable tool, it is our responsibility to question, assess, and act in the best interest of our patients. Thank you for taking time to watch our presentation. This has been presented by Double J's, by yours truly and Janine.
Thank you. Have a nice day. Bye.